Thank you very much, Philip. I have a feeling we are going to see your vesicles in some approved drugs by the FDA fairly soon. Yes, yes. Well, like you mentioned, you're using natural, readily occurring materials, and you're testing drugs that have already been approved in liposomes. So very, very, very interesting. Our next speaker is Dr. Challa Kumar, and very pleased to have Dr. Kumar fly up here from a much warmer climate. And I previously had met Dr. Kumar only indirectly, so it's very nice to have him here in person. Dr. Kumar obtained his PhD in synthetic organic chemistry from Sri Sathya Sai Institute of Higher Learning in Prashanthi Niyayam, India. And Dr. Kumar was a postdoctoral fellow at the very famous Max Planck Institute for Biochemistry in Munich, Germany. Currently, he is the group leader of nanofabrication at the Center for Advanced Microstructures and Devices in Louisiana. And I previously was just in a webinar with him from that location, so it's nice to be in the same physical place now. And he is also the president and chief executive officer of Magno Technologies. Dr. Kumar has authored over 30 publications, holds 10 patents granted or pending, and will be addressing us today on the following topic: magnetically modulated nanostructures in medical diagnosis, treatment, and tissue engineering. Please join me in giving a most warm welcome to Dr. Kumar.
Well, apparently the second slide has come before the first slide. Actually, I was just trying to analyze the previous speakers' presentations. I think one thing that's really struck me is that all of them talked about different designs for nanomaterial. So it appears to me as if there is a competition for who designs the best nanoparticles. So I'm really glad to be here in joining that competition, and hopefully Dr. Rothblatt would give us a prize at the end of the conference. So what I'm going to do today is to share with you some really exciting work that's going on the topic. It's a very exciting topic to me, which is magnetically modulated nanostructures. While I'm going to share with you what's going on in my own laboratory, I also would like to have a scaffold of information based on the research that's going on in the rest of the world. When I think of magnets, and I always think of the huge Earth. I think the place in which we are standing is a huge magnet. Earth is a huge magnet. Therefore, when you say magnetically modulated nanostructures, it's all very relative. The magnetic properties that we talk about are being compared here either with the micron size or the bulk size materials. Therefore, it's a relative to Earth. So when you look at Earth in comparison with the rest of the universe, rest of the galaxies, rest of the cosmos, so the Earth becomes probably less than a nano in size. So I think this is a very, very important point that we all need to keep in mind. It's all relative. That I happened to go to a very nice cartoon movie with my daughter, Who Hears What. It's a very interesting movie because the story is all about a huge elephant which carries a speck of dust on its trunk. And who is there on that speck of dust? There are innumerable millions and millions of people living on that speck of dust. So the story is all about how that elephant saves that speck of dust from destruction. So I think it's all relative. Magnetic applications are relative. Magnetic field are relative. So the next important thing is to remember is beware of fake nano. I mean, we keep hearing nano everywhere. So we have, for example, nano iPod. Of course, commercially it's been extremely successful. Then you have nano shampoo. You have nano cube aquariums. I mean, you think of anything, people tend to add nano. Of course, you have the cheapest car on the planet, which is the Nano, Tata Nano. And on top of it, there are several companies who add nano as a prefix just to make sure that their IP goes up. So we have to be really beware of nano. But what I'm going to share with you today is the real nano. I'm going to talk to you about the nanostructured materials, of course, which have magnetic properties. And there's nothing new. We started making the nanomaterials in laboratory only recently, probably a couple of decades ago. But then nanomaterials and nanostructures have been there in nature for a long time. And looking at specifically magnetic nanoparticles, this is an excellent example to think of before I start my presentation. That is migration of several fish and migratory birds. They seem to have magnetic, superparamagnetic iron oxide nanoparticles at the nasal. And that apparently seems to help them, guide them through several kilometer distances in finding their places. That's really amazing. So what I'm going to talk to you in this 15-20 minutes of time that I have is, what are magnetic nanostructures and why are they unique? What is magnetic modulation and what does it gives us? What kind of benefit the magnetic modulation gives us? What are the implications? And how this magnetic modulation gives us a unique opportunity in medical diagnosis, treatment, and tissue engineering. Then I move on to show you some excellent examples, excellent designs. Remember, I'm competing in this competition, so I would say it is an excellent design. So this design talks about integrated diagnosis and therapy. If you give me one more hour time, I think I would talk about the rest of it, but I'm not going to do it. That is truly important from my perspective because when we talk about nanotechnology and nanoscience, we are only envisioning some exotic techniques and tools which have no immediate applications in industry. But it's not really true. There are several nano tools and technologies that can be immediately applied in chemical and pharmaceutical industries. And that's why we have designed a concept called Innovation Box for implementation of nanotechnology tools. So when you really use this strategic tool to sort out various nanotechnology tools that are available, and you can really apply them into day-to-day activities like process development, product development in pharmaceutical industry. Okay, so why magnetic nanomaterials are unique? They are unique, simple. I'm not going to take too much time. They're unique because of three very important reasons. The magnetic nano properties can be altered. When you compare the bulk magnetic materials, in bulk magnetic materials, you have an opportunity to modify crystal structure, surface function, vacancies, defects, etc., in order to generate different magnetic materials with different magnetic properties. But when it comes to nano-sized magnetic materials, you have three additional components that gives us an opportunity to change or alter the magnetic properties. These are size, shape, and of course the composition. This second unique ability is that they can be conjugated to biomolecules. You can't do this with bulk materials. You can pretty much conjugate any type of biomolecule. You can conjugate DNA, you can conjugate peptides, you can conjugate antibodies, you can conjugate any organic molecule that you can think of. So that's the very unique opportunity that we have with magnetic nanomaterials. The third important aspect is that they offer multifunctionality. This multifunctionality can be obtained only with nano-sized materials, and magnetic nanoparticles offer an excellent opportunity in this aspect. So you can have control release imaging, drug delivery. Think of any feature that you need for biomedical applications. You can tailor your magnetic nanostructures and nanoparticles pretty much using this, this factor. So what I'm going to do is I'm going to give you a few examples how altering the size, shape, composition, is being utilized to solve a number of interesting problems. Let me start with the size, the influence of size. There's an interesting investigation that's been going on wherein people are trying to look at MRI contrast agents. For example, spion-based, superparamagnetic ion oxide nanoparticle-based contrast agents are very well known. But then, what is unique about spions is that they offer an opportunity to tailor-make contrast agents so that you can enhance the contrast depending on the tissue that you are trying to image, depending on the type of material that you would like to utilize for the contrast. So the first opportunity is to look at the size, influence of size. So different sizes of spions are possible to synthesize, and based on the different sizes that have been made, it's possible now to determine the optimum size that is really necessary for optimum contrast in magnetic resonance imaging of a number of tissues. Not only the size, you can also change the composition. For example, you have different types of ferrites that are known. All that you need to do is change the type of metal with these ferrites. For example, if you move from manganese, cobalt, or nickel. So these different types of ferrites have been synthesized, and an optimum metallic ferrite have been identified for contrast and magnetic resonance imaging. Now let's look at a very interesting concept that's being developed, which is the remote control of cellular functionality. I mean, if you look at cellular function, there is only one way that the nature does that. That is by using multifunctional ligands. What happens is the multifunctional ligands bind to several receptors on a particular cell, say for example, and the multifunctional ligands help in bringing the receptors closer, thereby triggering a cascade of reactions, cellular reactions. So the question is, can we use magnetic nanomaterials in order to trigger in a remote fashion such cellular functions? And there is a very interesting paper that's just came out in Nature Nanotechnology. The concept is, it's very simple and elegant. If you look at mast cells, which are actually the sentinels of immunoreactions. For example, if there are antigens coming in contact with the mast cells, these antigens are multifunctional antigens. Therefore, they attach to these different receptors on these mast cells and help them to come together. And once the receptors come together, they trigger in a cascade of reaction leading to increase in levels of calcium, which in turn leads to release of histamine. And that's what is responsible for your immune reaction. So what this remote control does using magnetic nanomaterials is, you have an antigen, a single antigen directly bound to a single nanoparticle. And then when you have such a construct, when you inject them into these mast cells, what you would see is a single nanoparticle attaching onto the single receptors. So at that stage, really there is no cellular reaction at all. But the moment you apply an external magnetic field closer to these mast cells, which have already been bound with the magnetic nanoparticles, you see a agglomeration of these receptors happening on the top of the cell, thereby triggering the release of cellular activities. And that's a very cool example I can think of, really looking at trying to physically, remotely control the cellular functions. And that's possible with the unique properties of these magnetic nanomaterials. I also would like to share an excellent example. I mean, we are all familiar with gene therapy, and we have seen several examples and several approaches to incorporate design nanomaterials to enhance the efficiency in gene therapy. There is a serious competition between the viral vectors and non-viral vectors for gene therapy. Non-viral vectors have several advantages, and two of the most advantages are that they don't have cytotoxicity and they don't generate any immune response. But then the problem with the non-viral vectors is that their transfection efficiency is pretty low. So there are designs being developed, nanomaterial designs being developed in order to increase the transfection efficiency. And one such elegant design is by using a cylindrical shaped nanomaterial. These are all nanorods. And these are multifunctional nanorods simply because you have two different metals in a single nanorod. One is made up of gold and the other one is nickel. And the advantage in such a design is that you can have the plasmid or DNA on one metal, and you can have a targeting agent onto the gold surface. And such materials have been shown to increase in transfection efficiency, and they have been extremely successful in gene therapy. Yet another example is development of implantable sensors, again using magnetic nanoparticles. These implantable sensor chips for cancer biomarkers are being designed based on a simple concept of what is called as magnetic relaxation switches. So the concept is when you have a magnetic nanoparticle, it has a certain amount of relaxation, say for example T2 relaxivity. But the moment this magnetic nanoparticle comes in contact with another magnetic nanoparticle, it changes its relaxivity. And this change in relaxivity is quantitative. And that's what is being utilized in development of implantable sensor chips. And what we see here is a sensor chip made up of silicon substrate, and then you have an alumina semi-permeable membranes. And within these, you have these magnetic nanoparticles bound to antibodies of, say, for example, cancer. The quantity of cancer biomarkers present within the human body. So that's, again, a very elegant example of utilizing the concept of magnetic relaxation switches using magnetic nanoparticles. Moving from very innovative ideas to solve biological problems, very interesting concept is the tissue engineering. This is magnetic force-based tissue engineering. Obviously, again, magnetic nanoparticles are involved. Here you have liposomes with magnetic nanoparticle core. And these liposomes are connected to, say, for example, stem cells. So when such stem cells bound to liposomes are utilized for agglomeration on a surface with a magnetic field underneath, what happens is there is a layer by layer assembly, a very simple and elegant layer by layer assembly of different layers of these stem cells. And when you remove the magnet, you can clearly isolate such sheets of stem cells. And apparently, such sheets of stem cells have been extremely effective in bone tissue engineering. The results have been compared with the bone tissue engineering made with such tissues in comparison with the free cells. And bone tissue engineering made with such tissues have been extremely good. The last example I would like to share with you is again a very elegant design. And this design consisting of a 3-in-1 system for magnetic resonance imaging, optical imaging, and photodynamic therapy. The nanoparticle design here is a magnetic core silica shell nanoparticle. And the silica shell consists of an iridium complex. And that complex is responsible for singlet oxygen generation, which is necessary for the photodynamic therapy. And this is also responsible for optical imaging. So such systems have been found to be very useful in cancer treatment. So having given you few examples as to how one can manipulate the size, the shape, and the composition, I would like to move on to the next stage of opportunity that we have to manipulate the magnetic nanomaterials, that is magnetic modulation using oscillating magnetic field. So this brings us to a next level of opportunity that we have for utilizing the magnetic nanomaterial. I would like to share with you two examples here. I think by now we are already familiar about thermotherapy, hypothermia using magnetic nanoparticles. And in fact, there is a company, MagForce Nanotechnologies. It's a German company which is in the final stages of clinical trials for treating glioma. So this is a very good example of using hypothermia to treat cancer. The next example I would like to share with you is remotely triggered release from magnetic nanoparticles. This is, again, a very interesting concept. The concept is based on generation of heat on application of electromagnetic force. So in this case, you have a DNA molecule bound to a magnetic nanoparticle, and a complementary DNA molecule is attached to complementary molecule, which is either a drug or a targeting agent or a diagnostic element, is attached to this particular construct. And when you apply an oscillating magnetic field, say about 4 kilohertz, this bond gets destroyed and releases this particular moiety. And this has been shown to be very successful even in vivo studies. I would strongly recommend you to go through this paper published in Advanced Materials last year. And this is a very elegant design. I mean, on one side, we keep hearing about magnetically modulated approaches, but this particular approach is really elegant. So now I move on to share the design that we have been working on in the past 4 or 5 years in my laboratory. And this particular design is a very ambitious design, and I would like to really call it as more a magic than a reality at this point of time. So what is this design that we are trying to develop? The questions that we asked were, can we protect the drug till it reaches the target? So the previous design that we have seen here, even though it's elegant, you would see that this drug moiety is exposed to the external environment. So that's not really desirable in biological milieu. So we were looking at trying to develop a system, design a system where the drug is protected till it reaches the target site. The next question we asked ourselves is, can we have multiple guidance and therapy? Many times what happens is you have a design element where you have a single guidance and a single therapy. And many times such single guidance is not really successful. So having an opportunity to have a multiple guidance and multiple therapeutic elements present in your design offers you a foolproof treatment options. The third question that we asked ourselves was, can we have remote control release? Remote is very important, and control is very important. The control release is important because we are not only trying to release the drug in a controlled manner, but you want to release it at the target site. So it has a combination of guidance and control release. And we also would like to release the drug however much we want at whatever time that we would like to release. So that's the key to answering this question. And of course, finally, can we have simultaneous diagnosis and therapy? I have no doubt in my mind that we are moving towards personalized medicine. The concept that most of the pharmaceutical companies follow, which is bulk drug concept. That is, you're trying to have a drug that is applicable for 7 billion people on this planet. And that's not sustainable at all. So we are going to move, if not today, in the next decade or so, into the personalized medicine. And this is key to the success in personalized medicine, having an opportunity to simultaneously diagnose and treat. So keeping in view that all these elements, having all these elements present in your design is key to successful magnetic modulated integrated diagnosis and therapy, we went on to design our nanoparticles. And here, what we looked at was LHRH as a targeting agent. LHRH is luteinizing hormone and releasing hormone. And this particular hormone has receptors at least in 15 different types of cancers. And these receptors are present in very large numbers on these cancers. The most prominent among the cancers in which the LHRH receptors present are breast, ovarian, and so on. So we decided to utilize the LHRH as a targeting agent. And then we need a magnetic element, and we need a drug that is protected. Therefore, you have a drug that is encapsulated within a polymeric material, and then you have magnetic nanoparticles, again, within a polymeric nanoparticles. So when you have such a design, one could, in principle, have a multiple targeting. The multiple targeting comes from LHRH, number one, and number two is through magnetic targeting. And you can have a multiple therapy. So you can release the drug using oscillating magnetic fields. You can also use hyperthermia. So it's a two-pronged approach for treatment. So having designed such a multifunctional nanoparticle, we went on to demonstrate various elements present in this design. So what are the various elements present in this design? First is, of course, to demonstrate that it's possible to have multi-targeting and therapy. Next is to design magnetic nanomaterials. One needs to design and optimize the magnetic properties in order to ensure that there is an optimum release of drugs within this polymeric nanostructure. The next element, very important element, is to demonstrate remote control release. And finally, it is important to demonstrate that such a construct we can also utilize for diagnosis. So let me give you some background on what's the drug that we have chosen. We have chosen lytic peptides as the anti-cancer drugs here. Lytic peptides are actually the next generation anti-cancer drugs. These are membrane disrupting peptides, and they have been shown to be extremely potent against breast cancer cells. As I've already mentioned, breast cancer cells express receptors for LHRH. So it is also known through our collaborators' research work at Pennington Biomedical Research Center that LHRH, when you combine it with the lytic peptide, this particular conjugate has a site specificity thanks to the LHRH ligand, and it has a therapeutic lytic peptide. So the only problem with a simple LHRH lytic peptide conjugate is that it also goes to gonads. The gonads have, obviously, the receptors for LHRH. Therefore, this particular treatment is, while it's effective, but it has its own side effects. So this is where our design is very effective. Now, just to say a little bit more about the LH ligands, they're really unique because not only LHRH ligands have receptors on breast cancer cells, the ligands themselves prevent reticuloendothelial uptake. And why is it so important? If you look at various nanoparticle designs, all those successful designs have PEG linkers. The reason why you have the PEG linkers is just to prevent RES uptake. And in our case, we have the LHRH not only acting as a targeting agent, targeting moiety, but also it's preventing RES uptake. Such a design we have demonstrated, I'm not sharing the results with you, is that you can counter the diffusional instability as well. So having this basic information, our design is supposed to work this way. You have the functionalized nanoparticles with a magnetic core, and you have the polymeric shell containing the lytic peptide conjugates, say, for example, Hecate, beta-CG, or you can even take just the simple Hecate, which is a lytic peptide. And you have the LHRH ligands on the surface of these polymeric nanoparticles. And such nanoparticles are anticipated to dock onto the breast cancer cells. And when you apply an oscillating magnetic field to such construct on a breast cancer cell, there is a release of drug. And this is the concept that we started working on. So the first thing that we did was to design appropriate magnetic nanomaterial. And herein we utilized what is called as a core shell structure. So the magnetic properties can be varied very elegantly by using this particular approach. So when you vary the size of the core and the size of the shell, you pretty much vary the magnetic properties. And you, in fact, get magnetic properties which are better than when you vary the composition of a single metallic nanomaterial. And that's what we have seen by having cobalt core copper shell and cobalt core gold shell nanoparticles. And then we went on to see whether really applying an oscillating magnetic field would help us to release these drugs in a controlled fashion. So to demonstrate this particular concept, we designed nanoshells based on manganese carbonate core and what is called as a layer-by-layer self-assembly approach. And when we design these micron core nanoshell particles with dispersed cobalt core and gold nanoparticles, and such design, when such nanoparticles have been taken into FITC solution, a fluorescent solution, we see that when you apply an oscillating magnetic field, the fluorescent dye permeates through these empty core nanoshell materials. Whereas when there is no magnetic field, there is no permeability of fluorescent dye within the empty core shell. So this clearly demonstrates that one can modulate the release of drug or any material by manipulating utilizing the oscillating magnetic fields. And in this particular case, we have utilized the cobalt core and gold shell nanoparticles. And we also would like to rule out that such a release is not based on the heat that's generated, rather than it is truly based on the oscillating magnetic field. So when we took these particular constructs in an FITC solution and heated the whole solution to 50 degrees centigrade, and we did not see any permeability at all of these nanoshells. So that clearly rules out the possibility that permeability is happening because of the heating. We have also looked at the influence of the size of the bilayers or the size of the shell. And we clearly see that there is a limitation on the size of the cell that is really important in order to optimize the design for a controlled release. We have also looked at the magnetic resonance imaging of LHRH spions. And we are really happy to see that when you have LHRH spions in comparison with the pure spions without any LHRH agent, there is an increasing amount of iron oxide nanoparticles within the cancer cells. And we could also see, this work is done in collaboration with Warren's group in Duke University. I'm not an expert in MRI, but what I hear is that you can clearly distinguish several features when you have LHRH spions in the magnetic resonance imaging of not only the breast tumor, but also the metastatic cells arising out of the primary breast tumor. I understand that the hyperpolarized helium MRI, in fact, helps in increasing the sensitivity of these lung metastatic cells, and one could clearly distinguish up to the micron size various metastatic cells that are present in the tissue. So what I'm going to do is I'm going to stop here. I know we are all waiting to finish this conference, and my time is also up. But as I mentioned, I think I just left this as a part of my presentation because if someone is really interested, they can go through it, and I'll be happy to discuss this. The whole concept is about developing the nanotechnology tools for pharmaceutical industry, and I'm going to leave it here. So the take-home message is that magnetic nanomaterials offer unique opportunities in medical diagnosis and therapy. And there are really broad range of nanotechnology tools that are available. The range is inexpensive to expensive, most elegant to simple nanotechnology tools. And I truly believe that the personalized medicine is the way to go. This is the tool, strategic tool that we are trying to develop, which is the IBIN, Innovation Box for Implementation of Nanotechnology Tools. Is a useful guide for strategic implementation of nanotechnology tools. And MagNano can provide assistance in implementing such tools in pharmaceutical industry. So I would like to thank you for your attention, and also, of course, collaborations are key to be successful in nanotechnology area. And I've been very fortunate to have wonderful collaborations from Duke University, Bonn University, and of course, people from LSU and CAMD itself. Thank you.